Welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us again. Going to be speaking with Dr. Irene Ghobrial. She's joining us to talk about the IMPACT study. Welcome to Health Professional Radio, Dr. Ghobrial.
Thank you. Thanks again, Neil.
Give our listeners a bit of your background. Talk about what it is, what your area of expertise is, and where it is that you're practicing.
Absolutely. I'm a professor of medicine at Dana-Farber Cancer Institute in Boston. I've been practicing here for about 15 years. Before that, I'm originally from Egypt. I trained in Detroit, Michigan, and then did my fellowship at Mayo Clinic, and then moved to Boston afterwards. I work in the area of multiple myeloma, and specifically in the area of early precursor, something called MGUS and smoldering myeloma, which are the stages just before multiple myeloma.
What is multiple myeloma for those who may not fully understand the condition?
Absolutely. Multiple myeloma is a blood cancer, just like lymphoma and leukemia. Some people may be more aware of those blood cancers. The cells are B cells, but they're more mature, so they're called plasma cells. They live in the bone marrow, which is the factory of all the cells that we have, the white cells, red cells, and platelets. And when patients get multiple myeloma, they may have it completely asymptomatic for years and years, and they don't know about it until it starts having problems, which is fractures of the bones or anemia or kidney failure.
Is it hard to diagnose when you're talking about fractures of the bone? Could that be a symptom that goes undiagnosed as a simple fracture but having nothing to do with multiple myeloma?
Sometimes, although usually when people start having the back pain or fractures or bone pain in general, this is when people start the workup. I think the more interesting question is, given that those cells secrete an antibody and its presence in the blood, can we diagnose it earlier? Can we screen ahead of time and not have to wait for people to have symptoms? And by doing that, we can diagnose people early before they have all of those problems.
Have you found that there's a genetic predisposition for multiple myeloma?
It's an interesting question. We know that there are certain people who are at a much higher risk of developing myeloma, specifically African Americans or blacks, as well as people who have a first degree or a second degree relative with blood cancer. We're not sure exactly why they would have that, and we're investigating this in something called the PROMISE study, where we're asking people actually who are either black or first degree relatives to be part of the study.
Is that separate from the IMPACT study that we're going to speak about briefly this evening?
They're related to each other. The IMPACT study is based on the PROMISE study. And
the IMPACT study is the immune profiling with antibody-based COVID-19 testing, correct?
Correct.
When it comes to COVID-19, are we talking about racial implications there as well, above and beyond what we've heard in the media?
Yeah, absolutely. I mean, we know that, so the IMPACT study is specifically for our patients who have precursor conditions or who are signing up on the PROMISE study. So you may not have any precursor condition, but you signed up on PROMISE. And we're asking a big question: what happens in Black Americans or people who have a blood cancer when they get COVID-19? What will happen to their prognosis? Will they have a worse prognosis, which we know now does have racial impact? But also, if we get the vaccine, and we now heard about potential approval today for the Pfizer vaccine, whether that will have an impact on our immune system. Will we all respond the same way? Will certain people not respond as well because their immune system is affected? So asking all those questions, we're trying to do a study, the IMPACT study, where we take blood samples at the beginning and we do the antibody test, so we see if you are already immune or not, and then we track those patients every 3 months for 1 year.
You have to get all of your study subjects before they potentially get the vaccine.
Not necessarily. So if you did get the vaccine, we're also asking the same question: what is the effect of the immune system? Because that's a very interesting question. Some people may get the vaccine but not have a good antibody response, and we will be able to get that.
Is it a local study, or is it nationwide, worldwide?
It's nationwide. It's not worldwide, but it's based on anyone who signs up on one of two studies that we have, either PROMISE, which is wide open for any Black American over the age of 40, or any first-degree relative of someone with blood cancer also over the age of 40, or if someone has already a precursor to multiple myeloma, something called MGUS or smoldering myeloma. And if they are signed up to this, then automatically they can also sign up to IMPACT. It's online. It's easy. They don't need a physician to co-sign the consent. And then basically it's a simple blood test after that. Every 3 months for 1 year.
Every 3 months for 1 year. And then the subjects will cease to be monitored after that?
For the COVID antibodies and for their immune system, but given that they are part of our original studies, the PROMISE or P-Crowd, we're monitoring them for a very long time. We're asking questions of why would someone progress? Why would someone develop myeloma? Why are African Americans 3 times higher, or they have a higher chance of developing myeloma than a Caucasian? What's different in that? Why would you, or how can we diagnose myeloma early and prevent it early? So there are lots of other questions that are also about the immune system, but more immune system and cancer rather than immune system and COVID, which is the current situation for this coming year.
What is the significance of the age requirement?
Sure, absolutely. So myeloma starts developing as we get older, and usually the median age of developing myeloma is around age 65. We know now that people may start developing that early MGUS by age 30 to 40, and we know that African Americans will usually get it at an earlier age. So that's why we started the screening program, which is a PROMISE study, to screen for MGUS or for myeloma by age 40. We could potentially go younger if there are people who have a very high or a very strong family history. So if someone's saying, my mom had myeloma and my aunt had lymphoma or something like this, we know there is a strong family history there, then we can look for a younger age.
Can you give our listeners a website where we can get some more information about the impact study and maybe any other related studies as you mentioned?
Yeah, absolutely. Actually, if they go to the impactstudy.org, they will be able to find information about both studies, which are the parent studies, the PROMISE study, and the P-Crowd study. And it's theimpactstudy.org. So www.theimpact is all one word, theimpactstudy.org.
Dr. Ghobrial, thanks for joining us here on the program this evening. Appreciate talking with you.
Absolutely. Thank you again for having me.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download a SoundCloud, and be sure to subscribe to our YouTube channel at youtube.com, Health Professional Radio.